A public health emergency has now been declared, and millions of people are extremely worried about what is coming here in the United States. Now, I want to be very clear on something. This public health emergency has been declared in Puerto Rico, but experts are concerned that this is going to make its way into the United States very soon, and I want to explain what this is and why experts are so concerned at this time. So, I'm going to break that down in just a moment. All I ask is one thing. It takes 2 seconds. Go ahead, hit that like button if you enjoy these daily updates. And now, let's begin. So why is the United States so concerned about a public health emergency that has been declared in Puerto Rico? Well, it's because of what that public health emergency actually is. Look at this. It says this could be the worst year yet for dengue in the Americas. They're talking about dengue fever. I want to show you this right here because Puerto Rico, they declared a public health emergency after a rise in dengue fever cases. It says Puerto Rico has declared an epidemic after the number of dengue cases continue to rise into the hundreds. The infection has been on the rise in much of Central and South America. This is just from March 26th. It is currently March 30th. This is the reason why millions of people are highly concerned because of what is coming. What we know is that there are thousands of people in a migrant caravan making their way into the United States at this time. Now, obviously, that's concerning, and it's not because of the potential terrorist risk, the potential cases of we see shelters shutting down because they're overpopulated, they don't have funding, things like that. That's a different story. But what they're saying is the people coming in right now could potentially be infected with dengue fever and not even know it. They may have no clue. I want to read you this. Here's how dengue actually spreads. Because it's not contagious from person to person. If, let's say, I were to have it, I would not be able to transmit it to another person. The only way is if a mosquito were to bite me and then go bite an infected person, and then that mosquito would then contract the virus and pass it on to somebody else. However, sometimes it takes more than a week before it can get contracted. Now, here's my personal advice, okay? This is just something that I like to do personally, just because for me, I think this is something that, I'm horrible with mosquito bites. Like they're just attracted to me for some reason, okay? There's a couple things you can get, and then we'll get back to this story. There's a couple things. First one, this is one of the things I love these things. Whenever we go camping or I go outside for sporting events or you go to the beach or whatever, put on a little bracelet, okay? It's a little bracelet like this. You can get a pack of 25 of them right now for $22 on Amazon. They even have a coupon. I'll put a link to this one down in the description box below if you guys want to check it out. There's another one right here. This one, love these. They're great for kids as well. Little sticker. You stick it on, put it on your arm, put it on the back of your neck, put it on your legs, depending on where you get mosquito bites quite a bit. Again, a pack of 90 of these, okay? These are not the most efficient things, but they work, okay? They don't last the longest, but again, they work, okay? So go and check those out. I'll put links to both of those down in the description box below. But here's what you need to understand. Dengue says the region of the Americas. This is from July 19th, 2023. It is still something that we need to be well aware of, and the reason for that is because of this. This is actually from the CDC website, and you can see right here, this was last reviewed on January 9th, 2024. It says, dengue in the U.S. states and territories. Dengue outbreaks occasionally occur in the continental United States. Dengue is common in the U.S. territories in American Samoa, Puerto Rico, and the U.S. Virgin Islands, and the freely associated states, including the Federated States of Micronesia and the Republic of Marshall Islands and the Republic of Palau. It says most dengue cases reported in the 49 continental U.S. states occur in travelers infected elsewhere. Again, the concern is people are going to contract this virus, okay, contract dengue fever somewhere else in another country, potentially Puerto Rico or American Samoa or wherever. Then they're going to bring it into the U.S. unknowingly, and from there it could be spread out, to many people. Well, here's the reason why I bring this up. It's not because if you contract it, you are going to die. Let me just give you the numbers here. It says roughly 50% of the world's population is at risk of dengue fever. Between 200 to 400 million people are infected each year. More than 40,000 people die each year from this. And in 2024 alone, we've had more than 3 million reported cases in just the Americas. So that's the reason why I bring this up, because there's a lot of people that are potentially at risk, many people that have already been affected by this, but here are the symptoms. Let me just break this down for you. Sudden high fever, as much as 105 degrees. Severe headaches, pain behind the eyes, vomiting, swollen glands, nausea, joint and muscle pain, rash that appears 3 to 4 days after the fever starts. Those are the symptoms. Now again, there are people that do lose their life because of dengue fever, but here in the United States, simple pain medication can pretty much do away with this. Now, I'm not a doctor. If you were to contract this, make sure you go to the doctor and they will tell you what would be best for you. I am not a doctor. I'm not a healthcare professional, just a guy on YouTube. Again, I want to be very clear on that. The next thing I want to just tell you, could we see a public health emergency for dengue fever here in the United States? Absolutely. According to the multiple experts, according to the World Health Organization, even the CDC, it is highly unlikely we're going to see this just because of the way the United States is, kind of our climate and stuff like that. But the concern is the amount of people coming into the United States. Okay, and this is why it's a huge concern. I brought this up before as well. The amount of people coming into the United States as a carrier for a disease or something, a virus. The problem is those people come into the U.S., don't know exactly what is going on. They just feel funny. They're not feeling well. They're sick, whatever. They go to the doctor. Doc tells them this is what they got. Okay. The concern is all those people that go into the clinic, the doctor, the hospital, wherever, they are now taking up a bed. They're taking up a nurse, a doctor. The other people that are there for potentially life-saving measures, what happens to them? That's the concern, is we might not have enough doctors and enough nurses in order to help all these people that are coming in and they don't really know what they have. So again, this is why experts say they're concerned, is because what's spreading is just various different illnesses. And the people coming into the U.S. who've never experienced this before, now it's something new. And so I just wanted to bring that to your attention. At this time, the concern isn't dengue fever. The concern is all those other symptoms. Okay? All those things could potentially be life-threatening. Again, I don't want to say that dengue fever is the safest thing in the world, because obviously it's not, if 40,000 people are losing their life every year. But just understand, there's all these things that kind of, this domino effect. And that's the concern at this time, is if all these people coming into the United States, potentially infecting others, this is why it's highly concerning, because what happens to those that are coming in because of life-threatening illnesses? And they get pushed back, or they don't come in because there's too big of a line at the emergency room. What happens then? So, just wanted to fill you in on this. I know a lot of people are saying that this is something that we will see in the United States. It is something we see every single year. It's nothing new, okay? But just understand that Puerto Rico declaring this a public health emergency just a few days ago, that's concerning, especially when there's tens of thousands of people every single week entering the United States, and we have no clue what country they're coming from, if they're even healthy, or what their plan is once they enter into the U.S. So we'll see what happens moving forward. All I can tell you is I will be here every step of the way. I'll fill you in on all the latest news and updates, but that is what we know as of today. So again, thank you guys for watching. Consider subscribing, and I'll see you guys on the next one.